Long-awaited and potentially major news on the pandemic this morning. COVID vaccines for children under 5 may finally be on the way. Pfizer is expected to submit a request to the FDA as soon as today to get emergency authorization for its vaccine for babies as young as 6 months. If given the green light, kids under 5 could start getting vaccinated by the end of this month. But there's quite a road to that. Joining me now is Dr. Paul Offit. He's a member of the FDA Vaccine Advisory Committee and the director of the Vaccine Education Center at Children's Hospital of Philadelphia. Couldn't be more happy to have you on a day like this. What do you think of this news, this reporting coming out, Dr. Offit?
Well, we all need to see the data. So my understanding is that the FDA's Vaccine Advisory Committee will be looking at these data on February 15th. The good news is the American public can look at it at the same time because it's an open meeting. It's not hard to get on that line and see it. And we just need to see. I mean, most importantly, we want to make sure that this vaccine is safe, that there's robust data that it's safe, that there's robust data that it's effective and consistently immunogenic for all the children less than 5 for whom it would be recommended. Then from there, it goes to the FDA, who either accepts or doesn't accept our recommendation. Then from there, it goes to the Centers for Disease Control and the Advisory Committee for Immunization Practices. So it's still a ways to go. But the most important thing is we need to see the data. Right now, we're all trying to read the tea leaves.
And that's exactly right. I mean, some of the reporting I've seen is that even if there isn't, it's in some of the reporting is that even if the data shows there isn't as much of an immune response, it is safe, and so we should get started on getting shots into these kids' arms. Let me read you one quote from the Washington Post on this. We know that 2 doses isn't enough, and we get that, said one of the people familiar with the situation. The idea is let's go ahead and start the review of 2 doses. If the data holds up in the submission, you could start kids on their primary baseline months earlier than if you don't do anything until the 3rd dose data comes in. What do you think of that?
That assumes that the 3rd dose works, that it's safe and that it's effective, which I think is an assumption no one's going to make. We want to see that anything that we recommend moving forward stands alone as something that is safe and something that's effective for children. We're not going to sort of count on future data to make sure that things work. I don't think it's going to play out that way. But again, we don't all know the data, so we're sort of trying to read between the lines as to what people mean when what they say. In February 15th, we're all going to be able to see what we're talking about.
So at this moment, for you, it just doesn't make sense to even be thinking towards any of it until the data is public.
Exactly. Well, I mean, we want to make sure that children are protected. I mean, certainly children, yes, less than 5 years of age, can be seriously infected. They can go to the hospital. They can go to the ICU, and they can occasionally die. It occurs less commonly, say, obviously much less commonly than those over 65, which is why if you're going to make that recommendation for this group that tends to get infected less frequently and less severely, you, number one, want to make sure there's a robust safety database, and 2, that it works before we move forward, because we need to maintain the trust of the American public that we're standing between the American public and the pharmaceutical companies to make sure that people only get products that are clearly shown to be safe and effective.
I'm going to remain very hopeful and also very much put February 15th on the calendar for us to speak to you right after that. It's great to see you, Dr. Offit. Thank you.